Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy part 9, calculate fluor 3. If you are new to T.S.T, viewing parts 1 to 6 is a must. Please remember this. In this part, many technical things have been described, elaborated. If you really want to learn this therapy, then you must see these 6 introductory parts. Number 20, Hodgkin diseases. Two types are there. There is 2 types of Hodgkin diseases there. Number 1 is Hodgkin lymphoma, HL. Number 2 is non-Hodgkin lymphoma. Both are cancer of lymphocyte cells. Lymphocytes are part of our immune system. Depending on the number of cells affected and their location, they are grouped as NHL or HL. NHL means non-Hodgkin lymphoma, HL is Hodgkin lymphoma. Between the two, NHL is worse. If these swell up to solid hard mass or into a soft hard mass, soft lax mass, if it is solid hard or soft lax, calcarea for 12x or 30x are employed to tackle initially. Mind this is a cancer case. So, calcarea fluor is a very deep acting and really good medicine. Many Hodgkin lymphomas have been completely recovered. Complete cure has been effected by this calcarea fluor. Now, this is a picture of Hodgkin lymphoma, Hodgkin disease. Preventive treatment. Prevention of natural abortion. To women who used to suffer from premature natural abortion owing to constitutional dyscrasia. There are a lot of ladies who used to suffer from this premature natural abortion. Calcarea fluor is a blessing to them, of God to them. When pregnancy test is positive, such women should take CF, calcarea fluor, 12x, 1 dose every 2 weeks with an occasional intercurrent dose of Kp 12x. This is also the preventive. Kp means calcarea phos. Sorry, calcium phos. First is calcarea phos, fluoricum. First CF is calcarea fluoricum, CF, Kp is calcium phosphoricum. Both are preventives. Please mind that in modern allopathic medicine, drugs are very much restricted to pregnant women. But for Homeo-Bio system, this is the most appropriate time to treat women because during pregnancy, their dormant dyscrasia comes up to surface. This is from the lap of the J.T.Kent, the giant of homeopathy. The next leader after Hahnemann is J.T.Kent of America, and become amenable to miasmatic treatment. That is, women are aptly treated during pregnancy period in homeopathy and biochemistry. Modern tissue salts. But allopathic medicine generally do not give them any medicine during this period. But this is our high time to give the medicine. Please remember this. Continuation of preventive treatment. B. Prevention of prolapse of rectum and uterus. When symptoms of prolapse in both cases start appearing, in case of rectal prolapse, the image is given in 1. See this picture. Mind this is a last level of the disease. This is the final stage of disease, complete prolapse. In this type of cases, almost no medicine work. This becomes a case of pure surgery, and that is also very troublesome. And this is the prolapse of uterus. Also, it is the final stage. So, it is better to treat this disease when the first symptom appears. That is being discussed here, prevention. The patient usually report a heaviness in rectum. For case of rectal prolapse, the first symptom is heaviness in the rectum almost always and frequent false arch for stool. And in case of uterine prolapse, this is uterine prolapse, the patient say they feel that something would coming out of vagina. These are the initial symptoms. Maybe after this symptom, one may take 6 months, some may take 1 year, 2 years to come to final stage. So you start treatment right then. Start administering Calcarea for 12 weeks, one dose every week. Continue it for 3 months. Then verify if the symptoms are still there. Continue it for 2 months more. Otherwise stop. But tell the patient to report whenever symptoms are returned. That is, patient is reporting something, but actual disease is not there. You are giving medicine. So you must check every 2 months, 3 months after whether the symptoms minimizes. If it is so, then stop medicine. But if it is not minimized, then you continue. In this way, you have to take the preventive treatment. You can increase, decrease the time, the interval period of doses, but you have to continue the treatment. Otherwise, there will be no result. Preventive treatment is continuing. See, hernia. Whenever slightest of symptom appear, start giving Calcarea for 12 weeks, one dose every week. If there is pain, heat, give ferrum phos 12 weeks alternately. The disease would nip in the bud. 21. In case of mastitis, if the breast is very hard, Calcarea for acts like a magic. Of course, at initiation of the disease, if ferrum phos and calimure 6x are given alternately, this stage would not appear. Fever and swelling of breast subside very soon. If you give the last two medicine, that is FP and KM, then mastitis, the advanced stage of mastitis, that is given in the figure, in the image right hand side below, that will not come. 22. If breast milk is dried or gets insufficient, Calcarea for 12 weeks twice a week render great help. Very often lactating mother face this problem. So in that case, Calcarea for 12 weeks and Calcarea phos also. This is Calcarea fluor 12 weeks and CP means Calcarea phos. It also may be a great remedy here in this case. Two images have been given. One is images of hernia. Hernia means protrusion of some abdominal content through abdominal wall foramen into the space between the skin and the abdominal wall. This is called hernia, and this is mastitis, that is inflammation of the female breast. Life case 1. Mrs. M. Jana, aged 36 years, mother of 2 children of 10 years and 5 years, came to Dr. Sen and reported that she tended to feel a heaviness in her lower abdomen for last 2-3 months, as if something would come down there. The same subsided promptly when she lay down or sat. On query, Dr. Sen came to know that over and above 2 offsprings, she got MTP, that is medical termination of pregnancy, done on her 3 times. That is, there has been a lot of pressure on her uterus, at least 5 times, 2 for the childbearing and 3 for MTPs. She, that is Dr. Sen, prescribed Calcarea fluor 12 weeks, one dose on every 5th day of a week for 1 month. Advised to avoid heavy weightlifting, to move along stairs, hard work, jumping, skipping, etc. Because all these situations aggravates the condition of prolapse. Actually, this is a primary symptoms of prolapse of the uterus. I think you can understand. Mrs. Jana came after 2 months and reported that all her trouble went up after 3 weeks. She was so well that she forgot to report. Life case 2. Mizarul Haq, aged 28 years, has been suffering from chronic tonsillitis for last 10 years. He got tired from treatment of modern allopathic medicines. When he got medicines, he felt relief. When stopped taking those, suffering returns. He didn't believe in tissue salt therapy, but from pressure of his dear friend, he was obliged to see Dr. Ray, an expert in tissue salt therapy. Dr. Ray checked the throat of Mr. Haq with his pocket torch and probe to note that both tonsils of his patient were like big walnut, and those were stony hard too. Those were not too much painful, uvula big, tongue full of cracks. There were troubles in his teeth too, bleeding occurred from the root of a loose tooth socket easily. On query, he came to know that Mr. Hawk had been suffering from vacillation of mind. That is, vacillation of mind means the person cannot take a firm decision. Taking bath, and he used to take bath in warm water around the ear. Dr. Ray prescribed Calcarea for 12 weeks, one dose on every third day of a week for a month, and also advised to take bath, and when he advised Mr. Hawk to take bath in ordinary water in a closed room. Amount of water may be less, but warm water would not do. Actually, it has been noted that if a person go on taking bath, if a person goes on taking bath years after having warm water round the ear, he becomes too much susceptible to temperature variation. Normal water, bathing in normal water is the best. So this advice was given to him. Review. After 1 month, Mr. Hawk returned timely. Dr. Ray checked that there was no trouble of tongue, teeth, uvula. However, the size of tonsils were as before, but those got softened. He prescribed Calcarea fluor 30x, one dose a week for 2 months. About 2.5 months after, Dr. Ray got a call from Mr. Hawk to report that he himself noted the size. That is, here Dr. Ray is informed by Mr. Hawk. Mr. Hawk is reporting. He himself noted the size of the tonsils with a mirror, and those were about half of their original sizes. He had been now busy with preparation of his imminent examination for a promotion in his office. Just note the things. He is now taking examination for promotion. That is, here he is now a bit better about his taking decision matter. That is, he is not suffering from vacillations of. He is now determined that he will take the exam. That is, there is a change in his mental state also. And also, the tonsil is getting smaller. With this, the video ends here. A lot of thanks for listening and viewing. Next, we will be meeting on another video, another new video.